वक्रतुंड महाकाय सूर्यकोटि समप्रभा निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा. A very profound good morning to all the dignitaries, guests, faculty and delegates with great joy and immense exultation. I, Poonam, Nursing Tutor, College of Nursing, AIMS Rishikesh, welcome you all on behalf of All India Institute of Medical Sciences, AIMS Rishikesh, for celebrating World Antimicrobial Week Resistance Integrated Antimicrobial Stewardship IAS Practices and Dandam from 18 to 24 November 2023, organized by Department of Medicine, College of Nursing, and various clinical departments of AIMS Rishikesh. World Antimicrobial Week is celebrated between 18 to 24 November every year. The World Antimicrobial Awareness Week aims to increase the awareness of global antimicrobial resistance and to encourage best practices among the general public, health workers, and policymakers to avoid the further emergence and spread of drug-resistant infections. Since 2019, multi-departments including Department of Medicine, College of Nursing, Microbiology, Pharmacology, CFM and majority of other clinical departments are celebrating World Antimicrobial Week, and this is the 5th in row. AIMS Rishikesh under the umbrella of WOW is celebrating this week with the theme for the WOW 2023 is Preventing Antimicrobial Resistance Together. A global action plan to tackle the growing problem of resistance to antibiotics and other antimicrobial medicine was endorsed at the 68th World Health Assembly in May 2015. One of the key objectives of the plan is to improve awareness and understanding of antimicrobial resistance through effective communication, education, and training. As we begin this program, we are obliged to evoke the presence of Almighty in midst us to complete the task fruitfully. So we are lighting the lamp. Deepar Jyoti Param Brahma, Deepar Jyoti Janardhana, Deepar Bhaktu Hartu Me Papam, Deepar Jyoti Namastute. With this thought, I would like to invite all the esteemed dignitaries to kindly come upon the stage to kindle the auspicious lamp to embark on today's proceeding. Thank you, everyone. Gracious welcome is an instance or manner of greeting to someone. Now, I would like to take a privilege to welcome all the dignitaries on this ceremonial occasion. We are privileged to have our honorable patron of this event, Professor Meenu Singh, Executive Director and CEO, AIMS Rishikesh. Madam has been awarded with various prestigious awards during her career, as well as she is the member of various committees. We are grateful to organize this 1 week celebration under the supervision of Madam. We extend our heartfelt thank you to you, Madam. We welcome you, Madam. I request Professor Ravikant, HOD Department of Internal Medicine, to kindly come forward and present a floral welcome as a gesture of honor to the respected Madam. Thank you so much, Madam. I express a warm-hearted welcome to Professor Jaya Chaturvedi, Dean Academic, AIMS Rishikesh, whose efforts and valuable support have brought all of us together. We welcome you, Madam. I request Professor Salandar Handu, Department of Pharmacology, to kindly present a floral welcome to respected Madam. I request Dr. Panda to come on his behalf. Thank you, Madam. Now I welcome Professor R.B. Kalia, MS Sir, AIMS Rishikesh. Okay, so Dr. Bharat Sir will come on his behalf, whose radiant personality encourages us to strive further. We welcome you, sir. I request Dr. Smriti Arora, Principal, College of Nursing, AIMS Rishikesh, kindly present the floral welcome to respected sir. Thank you, sir and ma'am. I welcome Professor Ravikant, HOD, Internal Medicine, whose efforts has made this event to happen. We welcome you, sir. I request Dr. Prasan K. Panda, Associate Professor, Department of Internal Medicine, Organizing Secretary of the event, AIMS Rishikesh, to kindly come forward and present a floral welcome as a gesture of honor to respected sir. Thank you, sir. Now I request Professor Salandar Handu, Pharmacology Department. Now I request Dr. Vartika Saxena, whose effort has made this event to happen. On her behalf, Dr. Pradeep Agarwal, if available, please come and receive the floral welcome, sir. Now I request Manish, sir, Assistant Professor, College of Nursing, AIMS Rishikesh, to kindly come forward and present a floral welcome to sir. I welcome Dr. Balram, Microbiology Department, without whose valuable contribution brought us to the celebration of this day. So we welcome you, sir. I request Dr. Mahendra, Dr. Balram, sir, Department of Microbiology, AIMS Rishikesh, to kindly present the floral welcome to respected sir. Thank you, sir. Now I welcome Professor Smriti Arora, Principal, College of Nursing, AIMS Rishikesh, who has taken all the efforts and give us the opportunity to organize this program. Welcome, madam. I request Dr. Prasan K. Panda, Associate Professor, Department of Internal Medicine, to kindly present a floral welcome to respected madam. Thank you, madam. Now I request all the secretaries and joint secretaries to come upon the stage. I request Professor Jaya Chaturvedi, Dean Academic Ma'am, to give a floral welcome to all of them. Dr. Prasan K. Panda, Department of Medicine. Mr. Manish Sharma, College of Nursing. Dr. Puneet Dhamija, Pharmacology Department. Dr. Ambar Prasad. Dr. Santosh Kumar, Community and Family Medicine. Dr. Pooja Badoria. Dr. Vanya Singh, Microbiology Department. ठीक है। Thank you, madam. I welcome Mrs. Rita Singh, Chief Nursing Officer, AMS Rishikesh, who inspire hope, ignite imagination, and instill a power of learning. Welcome, madam. I request Dr. Dr. Panda sir, to present a floral welcome to respected madam. Now I welcome Professor Salinder Handu, Department of Pharmacology, who has devoted his work to make this event happen. Welcome you, sir. I request Mr. Manish Sharma, Assistant Professor, College of Nursing, AIMS Rishikesh, to kindly come forward and present a floral welcome as a gesture of honor to respected sir. Now I request Meenakshi Dhar ma'am to come up on the stage, and I request Dr. K. Panda to please present a floral welcome to ma'am. Whether you come into a visit or just to rest, when you enter our home, may you be blessed. So to give a red carpet welcome to everyone assembled here, may I take a pleasure of requesting Dr. Prasann K. Panda, Associate Professor, Department of Internal Medicine, Organizing Secretary for the event, to welcome the gathering.
ये तो लग रहा है Good morning to all, and my respected Director Ma'am, Dean Ma'am, and MS Sir Vyapa, and all the other colleagues in my institute. हम लोग हिंदी में बात करना चाहिए, बिकॉज हिंदी हमारा भाषा है ही है, और यहाँ पे जितने भी ऑडियंसेस है ज़्यादा हिंदी से ही अंडरस्टैंड करते हैं. तो प्लीज़ पार्डन कि मेरा लैंग्वेज थोड़ा सा सही नहीं रहेगा मेल फीमेल, बिकॉज मैं हिंदी से पढ़ाई नहीं किया शुरू से. ये एंटीबायोटिक के और एंटी माइक्रोबियल अवेयरनेस हुई कि हम 2018 से स्टार्ट कर रहे हैं, और उसमें स्टार्टिंग से हम लोग एक्चुअली कुछ रिजोल्यूशन लिए थे, एंड दैट रिजोल्यूशन आई विल जस्ट अगेन गो थ्रू. ये हम 10 पॉइंट से स्टार्ट किए थे, अभी भी उसी 10 पॉइंट में हैं, और सभी को लेके चल रहे हैं कि क्लिनिशियन कुछ करना चाहिए, बिकॉज वी ऑल हैज टू बी लीडर एज ए हेल्थ केयर वर्कर. क्लिनिशियन को क्या करना चाहिए, माइक्रोबायोलॉजिस्ट को क्या करना चाहिए, फार्माकोलॉजिस्ट को क्या करना चाहिए, फार्मासिस्ट को क्या करना चाहिए, नर्सिंग ऑफिसर को क्या करना चाहिए, इवन पेशेंट एंड रिलेटिव्स को क्या करना चाहिए, और एज ए पार्ट ऑफ पब्लिक. हम कुछ रिजोल्यूशन से स्टार्ट किए थे 2018 से अभी तक, एंड वी रीच समवट, यू कैन टेल कि 20% परफेक्शन हमने कुछ मिला है अभी तक लास्ट 6 ईयर से. उसमें जो मेजर अचीवमेंट्स हुआ है कि हम टीम वर्क कुछ कर पा रहे हैं. अभी हम हर एरिया में जाके कुछ आइस ब्रेक सेशन करते हैं, उसमें कुछ आईएएस चैंपियन अवार्ड देते हैं. लास्ट ईयर जैसे गायनिक डिपार्टमेंट में मिला था, उससे पहले ईयर मेडिसिन आईसीयू को मिला था. इस टाइप लेट्स से कि दिस ईयर किसको मिलता है. उसमें वही फोकस ऑन द इंटीग्रेटेड अप्रोच. हम सिर्फ एंटी माइक्रोबियल को ध्यान नहीं देते हैं, एंड इन्फेक्शन प्रिवेंशन को ध्यान देते हैं. राइट डायग्नोसिस होना जरूरी है, बिकॉज डायग्नोसिस गलत कर रहे हो, कितने भी एंटीबायोटिक आप अच्छा दे दो कोई फर्क नहीं पड़ता उसमें. तो नेक्स्ट क्वेश्चन आता है कि डायग्नोसिस स्टूवर्डशिप हम अच्छा करते हैं, मेनली इसमें सैम्पलिंग कैसे बेस्ट होना चाहिए, सैम्पलिंग का रिपोर्ट कितना अच्छा आना चाहिए, टर्न अराउंड टाइम कितना जल्दी आ सकता है. एंड लास्ट पार्ट वाज द यूज ऑफ प्योर और ऑप्टिमल यूज ऑफ एंटी माइक्रोबियल. उसमें हमने कुछ स्टार्ट किए थे कि रिजर्व ग्रुप ऑफ एंटीबायोटिक, एक्चुअली जो AMR क्लासिफिकेशन आपने सुना होगा कि हमने 2 साल से स्टार्ट किए थे, कुछ डिपार्टमेंट में फॉलो किया है, बट Overall, if you'll ask me, we are in the 20% range of perfection. Still 80% हमको जाना है. सबसे एक इम्पोर्टेंट पॉइंट हम जो स्टार्ट किए थे वो अडल्ट वैक्सीनेशन, बिकॉज हेल्थ केयर वर्कर वैक्सीनेशन नहीं होंगे, हम एक्चुअली पेशेंट से उम्मीद नहीं कर रख सकते कि वो वैक्सीनेशन मिलेगा उनको अच्छी तरह से. तो दैट एडल्ट वैक्सीनेशन वी आर ऑल्सो स्टार्टेड आवर डिपार्टमेंट अराउंड 95% वैक्सीनेटेड है हमारे जितने भी हेल्थ केयर वर्कर, और टोटल इंस्टीट्यूट में भी डॉक्टर अंबर विल ऑल्सो कंफर्म दैट. तो दैट विल बी मोर ऑफ एन 92 or 93% about the hepatitis B and the last COVID outbreak or COVID vaccination. बट और कुछ वैक्सीनेशन बचा हुआ है, दैट ऑल्सो टारगेट कि हम इस साल में 2024 तक कंप्लीट कर लेंगे. एंड ये रिजोल्यूशन एक्चुअली हमने जो स्टार्ट किए थे एंड अभी तक हमने कुछ पहुंचे हैं. आज हम पहला दिन इनॉग्रेशन कर रहे हैं, उसमें आई वांट टू सी ए वीडियो. आई वांट टू शो ए वीडियो एंड देन आई विल एंड माय टॉक. Thank you all.
Thank you, sir, for enlightening us about the theme and week celebration. Now, I would like to invite Professor Jaya Chaturvedi, Dean Academics, AIMS Rishikesh, to kindly deliver the keynote address.
Good morning, everyone. Respected Director Ma'am, other faculty members, and my dear students and nursing officers. Two vow. One is say no to violence against women. That is also given by WHO. And another vow is say yes to this. That is antimicrobial resistance should not develop. For that, we have to work hard. And no new antimicrobial recently developed combinations are coming, but whatever was developed or देखा गया, everything is at standstill at present. So we have to save these antimicrobial so that it should not develop its resistance. And resistance prevent करने के लिए what we should do is do or use them judiciously. And that judicious thing is we clinicians have to attempt किसी भी एंटीबायोटिक को जस्ट कि मुझे अच्छा लगता है इसलिए वो एंटीबायोटिक लिख दिया इट शुड नॉट बी लाइक दैट वी हैव टू डायग्नोज द पेशेंट प्रॉपरली एंड उसकी डायग्नोसिस के बाद उस एंटीबायोटिक को लिखना है इमीजिएटली पेशेंट के आते ही एंटीबायोटिक नहीं स्टार्ट करना है दैट शुड बी अवर मोटो एंड दिस अवेयरनेस वीक will emphasize on all these things. All the best to medicine department and other departments involved. Thank you so much.
Thank you, madam, for your thought-provoking address. We are honored to have Professor Ravikant sir, HOD, Internal Medicine, AIMS Rishikesh, with us. I request sir to kindly come forward and bless us with his few remarkable words.
Most respected Director AIMS Rishikesh, Professor Minu Singh Madam, Dean Academics, Professor Jaya Chaturvedi Madam, my colleagues from Department of Medicine, from other departments, College of Nursing, students, supporting staff, and all participants of the WOW. I'm happy to say that WOW is ever increasing in size, its energies, and we are really doing wonderful work so far as the antibiotic resistance is concerned. And we are happy to announce that with the department meetings that we conduct every month, that we are involving microbiologists, ANS, DNS of respective areas, Unit 1, Unit 2, and ICUs. We have been able to find out the resistance pattern in our ICUs, and we have been able to formulate the antibiotic policy for our ICU, which is a role model for the entire hospital. I think we need to come up with this kind of activity for our in-hospital management of infections. And of course, the requirement is regulatory use of antibiotics now. I think there should be reserved antibiotics for certain departments. And I think we are taking a step forward to involve the state government also to chip in with this antibiotic stewardship program and to release a guideline which can be followed by primary, secondary, and tertiary. Let us see to what extent we will be successful, but we have started this move, and I'm happy Dr. Prasanna Panda is taking a lot of initiative in this direction, and we have been able to, have certain guidelines which we are following, and I'm thankful to you all for being a part of this work. Thank you very much.
Thank you, sir, for your words of wisdom. A perfectly blended personality, our philosopher and guide, her efforts needs no introduction. The result speaks for itself. May I invite Professor Meenu Singh, Executive Director and CEO, AIMS Rishikesh, to address the gathering. Please, ma'am.
Thank you very much. And after a huge round of floral welcomes, I think let's have a huge round of applause for all the organizers of this World Antibiotic Awareness Week. As you know, Antibiotic Awareness Week is an event which is supported and organized by World Health Organization. And this time the theme is antibiotic awareness, preventing antimicrobial resistance together. So antimicrobial resistance is the key word here, and together is another key word. And it's really nice कि सब रंगों के लोग यहाँ पे बैठे हुए हैं. There are people who are coming from nursing, from medical, from allied health sciences, our students, our residents, they are all there. और ये togetherness जो है, that is actually, as by WHO, it is not amongst the medical professionals. It is along the medical and non-medical professionals. As we know, and that is the motto of the workshop also here, the One Health approach. And that One Health comes from looking after not only the humans, but also the animals, the plants, and also the whole environment. And I think we should also worry about looking after the microbials, the microbes, because they are the ones which we are targeting, but they are also helping us in a very big way in preventing many of these infections. As you must have heard that even in Ganga water, which we keep discussing, that it doesn't rot, although so many people take bath in it and they dirty it, but still it doesn't rot. So the reason is probably that there are some substances which are antibacterial, which are present in Ganga water, and probably they are microbes. They're probably viruses. So if we study all this, I think, and we come to know that certain practices can actually prevent infections, and some of the practices can even treat infections, then maybe we will not think of कि जरा सा गला खराब हुआ तो एरिथ्रोमाइसिन खा ली, जरा सा बुखार हुआ तो एमॉक्सिसिलिन खा ली. फिर लेकिन जब सच में बारी आई किसी को एरिथ्रोमाइसिन यूज करने की या एम्पिसिलिन या एमॉक्सिसिलिन यूज करने की, तो वो काम ही नहीं करेगी, क्योंकि जितने बैक्टीरिया बॉडी में थे जो इन ड्रग्स को सेंसिटिव थे वो तो मर गए, लेकिन जो दूसरे थे जो ज़्यादा खतरनाक थे, मे बी स्टैफ ऑरियस और अदर स्पीशीज, दे बिकेम मोर प्रोमिनेंट. सो बचपन से ही इट इज़ वेरी इम्पॉर्टेंट दैट ऑल हेल्थ वर्कर्स, मतलब दे treat their children as well as the children or adults they are advising in such a way that we ask them to wait, to wait for some time, don't have such a low threshold for giving antibiotics. Because जितना ज़्यादा एंटीबायोटिक हम खाते हैं, हम अपनी बॉडी के साथ उतना ही अन्याय करते हैं, क्योंकि हमारी बॉडी जो आपको मालूम है बहुत ज़्यादा माइक्रोब्स है हमारे अंदर, एंड दैट वी कॉल एज माइक्रोबायोम. और आजकल ये प्रूव हो चुका है कि जो हमारी बॉडी का माइक्रोबायोम है वो हमारी पर्सनैलिटी भी बनाता है, वो हमारी डिजीजेस भी रेगुलेट करता है, वो इवन हमारी मेंटल स्टेट्स जो हैं उनको भी रेगुलेट करता है. देयर इज अ गट ब्रेन एक्सिस, देयर इज अ एक्सिस विच एसोसिएट्स दीज बैक्टीरिया विच आर देयर इन द गट विद ऑल अदर डिजीजेस. सो वी शुड बी वेरी वेरी केयरफुल कि हम इन चीज़ों को ज़्यादा अफेक्ट ना करें. आपने बहुत बार देखा होगा कि कई बच्चे जिनको या बड़े जिनको मान लीजिए टाइफॉइड हुआ या उन्होंने सोचा कि ये टाइफॉइड है, दे टुक अ कोर्स ऑफ एंटीबायोटिक्स एंड आफ्टर दैट दे गेन्ड अ होल लॉट ऑफ वेट. बहुत ज़्यादा कई लोगों का वेट गेन हो जाता है. दे रीच अ लेवल ऑफ ओबेसिटी एंड दे बिकम प्रोन टू मेनी अदर नॉन कम्युनिकेबल डिजीजेस. So ये सारे जो concepts हैं, these should be understood, and they actually need a lot of research also, and I'm sure all of you will be interested in doing some research in this particular field, which will help us define, when and how we should take antibiotics. So actually, WHO has produced a document which I requested Dr. Panda to circulate amongst all the health workers today. It is called AWARE, and that is access and watch and then prescribe antibiotics. Stay away from antibiotics. Actually, this is a document which actually tells you to stay away from antibiotics. और एंड में अगर एंटीबायोटिक की ज़रूरत भी होती है तो देव गिवन प्रोटोकॉल्स विच आर एविडेंस बेस्ड विच आर बेस्ड ऑन साइंटिफिक फाइंडिंग्स कि बहुत सिंपल एंटीबायोटिक्स यूज़ करने की ज़रूरत है इवन व्हेन अ पेशेंट कम्स विद सेप्सिस मान लीजिए डिसेमिनेटेड सेप्सिस और निमोनिया in those situations also one can start with simple penicillins, one can start with simple amoxicillin. Penicillin का तो ये हाल हो गया कि मिलनी बंद हो गई है because we have all got so used to prescribing all high-end antibiotics. Nobody talks less than cephalosporin at least. Cefotaxime, that is actually the second line, or ceftriaxone, that is also the second line antibiotic. And then you think of other staph infection hai, then you think of cloxacillin or you think of amikacin. सो बस इतने से ही एंटीबायोटिक उसमें डिस्क्राइब किए हैं उस डॉक्यूमेंट में अगर आप उसको पढ़ें उसमें देर इज़ नो मेंशन ऑफ सेफापाइम देर इज़ नो मेंशन ऑफ मेरोपेनम देर इज़ नो मेंशन ऑफ ऑल दीज न्यू exotic antibiotics which have come up which we kind of write at the drop of the hat. जैसे मैडम ने बोला कि वो बस उनको अच्छा लगता है इसलिए वो लिख देते हैं या उनको मालूम ही नहीं है कि वो अच्छा क्यों लगता है. What is the reason? They've just been taught by some drug representative or something, and that is what they are trying to practice. So be very, very careful about writing antibiotics because we are getting short. This is also a race against time because all antibiotics are finishing. There will be a time when the organisms will be, ruling the world, and all these will be resistant organisms, and you will be surprised that these weekly meetings which we do for statistical meetings when we discuss our patients who have passed away, we find that many of these patients when they come to hospital they don't have infection, but जैसे वो enter करते हैं within 3-4 days only they come positive for some bacteria. We don't even work them up for many other fungi and other things because वो भी बहुत ज़्यादा prevalent है infection. अगर बैक्टीरिया नहीं है, अगर आप बहुत ज़्यादा एंटीबायोटिक यूज़ करके बैक्टीरिया खत्म कर दोगे तो फंगस का इन्फेक्शन हो जाएगा and that will be much more difficult to treat. So I think with these some of the thoughts which are coming to my mind, I think we should pledge that we will use antibiotics in a very, very careful way, and we will consider all other species also when we are thinking of writing antibiotics because these antibiotics are also killing many other animals. The antibiotics which we prescribe, they get into the ecology, and many of these are then consumed by other animals, and they also become, kind of resistant to many of these antibiotics, and they are getting very exotic diseases which come back to humans then. So it's a kind of cycle which we have to break, and humans, because they are thinking animals, I think they can break it. And we have a whole lot of evidence and we have a whole lot of attitudes now to prevent and reduce antimicrobial resistance. With those words, I give my best wishes to this group who has organized it. Yesterday, we signed a MOU with SASPI, which is another society which has been started in AIMS Rishikesh in collaboration with PGI Chandigarh for preventing microbial resistance. And I'm very proud to say that Dr. Panda is actually spearheading many of these campaigns. And we're really thankful to Dr. Handu, Dr. Jaya Chaturvedi, Dr. Minakshi, and all others who are present here who have been supporting this particular cause and bringing out a quality initiative in the institute so that we adhere to evidence-based guidelines as far as antibiotic use is concerned. So thank you very much. Thank you.
Thank you, madam, for your kind words. Now, I would like to take a privilege to propose a vote of thanks on behalf of WOW Team 2023. I would like to express my sincere gratitude to our beloved director, Professor Meenu Singh ma'am, Dean ma'am, and MS sir for their blessings and kind words. Also, I would like to express sincere thanks to all the HODs, faculties, students, delegates, and everyone who has directly or indirectly contributed to this program, to make this program successful. Thank you everyone for joining us. Now it is time for the tea break. I would like to request all the dignitaries, guests, delegates to move toward the outside area for high tea. We will resume here after the tea break. Thank you all.
जानकारी है